Have you ever felt unusually tired? So much so that even lifting a cup of tea felt like a chore, but brushed it off as just part of aging? If so, you're not alone. And I want to gently tell you, it could be something more. I'm Dr. Ariana, and I've spent over 15 years helping older adults stay sharp, safe, and independent. And one of the most heartbreaking things I see is seniors ignoring little signs. Subtle changes that seem harmless at first, but turn out to be early warnings of a stroke. You see, strokes often don't come out of nowhere. In fact, many give off gentle whispers, small clues that something isn't quite right, weeks before they strike. But because these signs are easy to miss, many people only realize the danger when it's already too late. In today's video, I want to walk with you through 8 of these silent warning signs. Each one may seem small, but together they can paint a clear picture that your brain needs help. Please stay with me until the end, because recognizing just one of these signs early might save your life or someone you love. Let's begin. 1. Sudden, unexplained fatigue. Let's begin with one of the most overlooked warning signs. Sudden, unexplained fatigue. Now, I'm not talking about feeling tired after a long day or missing a good night's sleep. This kind of fatigue comes out of nowhere. You might wake up feeling fine, but by mid-morning, it's as if your entire body has lost its strength. Even standing at the sink to wash a dish feels like too much. I remember a patient of mine, Mrs. Eleanor, 76 years old, sharp as a tack. She told me one day she just couldn't fold her laundry. I thought I was just getting old, she said. But what she didn't realize was that her brain was struggling with reduced blood flow, a warning sign that something serious was happening. You see, when a part of your brain doesn't get enough oxygen, your body goes into protect mode. It slows you down. That overwhelming tiredness is your brain's cry for help. And the scary part? Many people rest, feel a bit better the next day, and then forget it ever happened. But about 1 in 5 people who have this kind of unexplained fatigue will experience a full-blown stroke within weeks. If this happens to you, sudden, deep tiredness with no clear cause, don't wait, especially if it feels different from your usual energy dips. Listen to your body. It knows more than we think. Fatigue isn't just about being sleepy. It can be your brain waving a red flag. And when you catch that flag early, you give yourself the best chance to stay safe. 2. Brief memory lapses or confusion. The second silent warning sign may not be something others notice right away, but you might feel it deep inside. Brief episodes of memory loss or confusion. Imagine this. You walk into the kitchen to get something, but suddenly you forget why you're there. Or you're on the phone, and midway through the conversation, you can't recall a familiar name, or even what you were just talking about. Now, we all have moments like that. But what I'm talking about here feels different. It comes on suddenly without warning. And for a few minutes, things feel foggy. You may feel disoriented, unsure of where you are or what time it is. And then, just like that, it passes. This isn't typical aging. This is your brain's warning signal that blood flow may have briefly been interrupted, what we call a mini-stroke, or TIA, transient ischemic attack. I once had a gentleman named Mr. Harris come in. He couldn't remember driving himself to the clinic. His wife said he seemed off for about half an hour, asking the same question over and over. By the time I saw him, he was back to normal, but tests showed he'd had a mini-stroke. These episodes are easy to dismiss, especially when you feel fine afterward, but they can be the final warning before a major stroke strikes, sometimes within days. If you notice unusual confusion, repeated questions, or blank spots in your memory, take it seriously. Even a moment of disorientation deserves attention. It's not just forgetfulness. It could be your brain crying out for help before it's too late. 3. Slurred speech or trouble finding words. The third sign is one that often catches families off guard. Sudden difficulty speaking or finding the right words. Let me be clear, this isn't about forgetting a word here and there. That's normal. What I'm talking about is when, all of a sudden, the words just won't come out right. You may try to say something simple like, I'm going to the store, but it comes out jumbled. Or worse, you can't say it at all. Your mouth may feel heavy. Your tongue might not move the way it usually does, or you might say the wrong word without realizing it. I remember a patient, Mr. Billings, 72 years old. One morning, his daughter noticed he was talking funny, like he was drunk. He was slurring his words and using sentences that didn't make sense, but he insisted he was fine and didn't want to go to the hospital. That afternoon, he had a major stroke. What had happened that morning was a mini stroke, a short disruption of blood to the part of the brain that controls language. Many people don't recognize this sign because it goes away quickly. Within minutes or an hour, your speech may return to normal, but that doesn't mean you're in the clear. When your speech changes suddenly, even for just a few moments, it's a medical emergency. Try this simple test. Ask the person to say a clear sentence like, "The sky is blue in Kentucky." If they slur, mix up words, or can't complete it, call for help immediately. Don't wait to see if it passes. When it comes to your brain, time truly is everything. 4. Sudden dizziness or loss of balance. Now let's talk about something many seniors chalk up to just getting older: sudden dizziness or trouble with balance. You may feel like the room is spinning or like you're walking on a boat. You might suddenly reach for a wall or a chair to steady yourself. Some people even feel like they're about to faint, even though they were feeling fine just moments before. This is not the same as getting up too quickly and feeling lightheaded. This kind of dizziness often appears out of nowhere, and it doesn't improve when you sit or lie down. One of my patients, Mrs. Carmen, told me she was brushing her teeth when the floor suddenly felt like it was tilting. She thought it was a blood sugar drop and went to lie down. Thankfully, her daughter insisted she go to the ER. A scan revealed she'd had a mini stroke affecting her cerebellum, the part of the brain responsible for balance and coordination. Here's why this is so serious. When blood flow to the balance centers of the brain is disrupted, even briefly, your body reacts with disorientation. But because it comes and goes quickly, many people wait it out, missing the small window to prevent something worse. Dizziness paired with unsteadiness, blurred vision, or difficulty walking is a red flag, especially if it's sudden and unexplained. Don't brush it off. Falls caused by loss of balance are a major cause of brain injury in seniors. But sometimes, the fall isn't the cause of the stroke. It's the result of one. So if your world suddenly tilts or your legs give out, stop, sit, and seek help. Your brain may be trying to protect you. 5. Numbness or weakness on one side of the body. One of the clearest, but still often missed, early signs of a stroke is numbness or weakness on one side of the body. It can happen in the face, arm, leg, or all three. Maybe you wake up and your hand feels tingly, or your foot seems to drag a little when you walk. Some people notice that one side of their face feels heavy, or their smile looks uneven in the mirror. The key here is that it's one-sided and it appears suddenly. I once cared for a gentleman named Mr. Leo. He called his wife to open a jar for him because his right hand felt asleep. He assumed he'd slept on it wrong. But when she saw his face slightly drooping on the same side, she knew something was wrong. He was having a transient ischemic attack, a mini stroke. Here's what happens. When blood flow to a certain part of your brain is interrupted, the nerves that control the opposite side of your body stop working properly. That's why a problem in the left side of the brain might cause weakness on the right. Even if the numbness fades in an hour, it still counts as a warning. Mini-stroke symptoms often go away, but they're your body's way of saying, "I need help right now." Try this simple test. Raise both arms in front of you. If one drifts downward or feels too weak to hold up, call 911. You're not being dramatic. You're being wise. Catching this sign early can be the difference between full recovery and lifelong disability. 6. Sudden vision problems in one or both eyes. Let's move on to a warning sign that often gets blamed on just tired eyes. Sudden vision changes, especially in one eye. It might look like a dark curtain is falling over your sight. Some people describe it as blurred vision. Others say everything looks foggy or dim. Sometimes it's like losing part of your field of vision, only seeing the left or right half of what's in front of you. Now, I know it's easy to blame these changes on dry eyes, new glasses, or just getting older. But sudden temporary vision loss, especially if it goes away after a few minutes, can be one of the brain's most urgent red flags. I remember Mrs. Jean, a 68-year-old piano teacher. She told me one afternoon while reading a book, her right eye just went black for about 5 minutes. She thought it was nothing, maybe from eye strain, but within 2 days, she suffered a stroke. What she experienced was amaurosis fugax, a brief blockage of blood flow to the optic nerve. Here's the truth. The brain processes vision in multiple areas. When blood flow to these areas is reduced, even briefly, the result can be vision loss without pain or warning. If this happens, don't wait for it to happen again. Sudden vision problems, especially if they last more than a few minutes, should always be treated as a medical emergency. Even if your eyesight comes back to normal, the risk of a major stroke remains high. Your eyes aren't just windows to the soul. They're often the first windows into what your brain is struggling to tell you. 7. Sudden, severe headache with no known cause. The 7th warning sign is one that too many seniors ignore or try to sleep off. A sudden, intense headache that feels unlike anything you've had before. I want to be clear, this is not your usual tension headache or a mild ache after skipping your coffee. This is often described as the worst headache of my life, or like a bolt of lightning hitting your head without warning. It can strike in seconds. Sometimes it comes with nausea, sensitivity to light, or even a strange pressure behind one eye. I recall a patient named Gloria. She was 70, in good health, and never had headaches in her life. One evening, she suddenly clutched her head and said it felt like something exploded inside. The pain was so intense, she couldn't stand up. Her family thought it might be a migraine, but it was a mini stroke, the kind that causes bleeding in the brain if left untreated. The problem is, many older adults dismiss this kind of pain, especially if it eases up after a few hours. But by then, the damage may already be done, or just moments away. Headaches caused by stroke or mini-stroke usually don't respond to pain medications like aspirin or Tylenol, and they often come with other subtle symptoms: dizziness, confusion, or weakness. If you or a loved one experiences a sudden, unfamiliar headache, don't try to tough it out. Get help. It's better to be safe and find out it's nothing than to ignore it and face something that could change your life forever. 8. Sudden confusion or not recognizing familiar people or places. The 8th and final warning sign may be the most frightening of all, especially for your loved ones. A sudden moment of confusion where you don't recognize familiar people or places. It often happens quickly. You might be sitting in your favorite chair, and suddenly you don't remember where you are, or you're talking to someone you've known for years, but for a moment, their face doesn't feel familiar. These episodes can be deeply unsettling. They don't last long, maybe just a few minutes or an hour, and afterward, everything seems normal again, which is why so many seniors and their families shrug it off as just a senior moment. But these are not just lapses in memory. They're disruptions in brain function caused by a brief interruption in blood flow, often to the temporal lobes, the area responsible for memory and orientation. I cared for a woman named Helen, age 74, who drove to the grocery store and once she got there, forgot how to get home. She called her daughter, crying, saying, "I don't know where I am." By the time her daughter arrived, Helen was completely fine again, smiling, even laughing at herself. But 3 days later, Helen had a major stroke. This early episode was her body's final warning. a red flag waving in silence. So please, if you or someone close to you seems suddenly lost, confused, or unaware of familiar surroundings, even if it passes quickly, don't wait. These brief disorienting moments can be the brain's way of saying, something is wrong, pay attention. And when you listen to that whisper, you might just stop a storm before it hits. So now we've walked through 8 silent warning signs your body might give you, sometimes weeks before a stroke ever strikes. And here's the truth. Most strokes don't come out of nowhere. They whisper first. They show up as sudden tiredness, a little slurred speech, a moment of confusion, or a strange flicker in your vision. And because these signs often pass quickly, many seniors simply ignore them. But ignoring them can cost you your independence, or even your life. I've seen far too many families come to me with the same heartbreaking words. She didn't think it was serious. He felt fine the next day. That's why I'm here with you today, not to scare you, but to empower you. Because knowing what to look for is the first step toward protecting your brain, your body, and your future. If you ever notice one of these symptoms in yourself or someone you love, pause. Take it seriously. Call a doctor or go to the emergency room. Even if it turns out to be nothing, you've made the right choice. And if this video has helped you, please share it with someone in your life who's over 60. You might just help them catch a warning before it becomes a crisis. And don't forget to subscribe to Elderly Whisper, where I, Dr. Ariana, bring you caring, trustworthy health advice, always with your well-being in mind. Stay safe, stay aware, and always listen to your body. It knows more than we think.